Start pantama, ma'am. Ma'am, start pantama.
Yes, please start.
Saravanan, start pantama.
Yeah, he's ready.
Yeah. Good morning, everybody. We need to stand strong, healthy, and hope-filled in these times of deep change. In order to come out the situation wiser, braver, and better, I felt it only appropriate that the Department of Physical Education, Anna College, organizes a national seminar on mental health and physical fitness post-COVID-19. The speaker on this occasion, Dr. Dobson Dominic, MD, Sports Medicine, has been heading the Department of Sports Medicine and Sports Science at Saveetha Medical College, Chennai, for several years. Charming, erudite, with excellent oratorical skills, I could not find a more suitable expert to enlighten us on this subject. I would like to express my gratitude to the members of the management, Punjab Association, for their constant encouragement and support, and to our dynamic principal in charge, Dr. R. Shanti Madam, for her guidance. It is the cooperation and the appreciation that I received from the staff members of Anna Adarsh College and students of this institution and physical education friends that urges me to organize such a webinar. The dynamic and talented Mrs. A. Patmavati, BWF coach and national umpire Sharjah, UAE, and the seminar sports secretary of Anna Adarsh College has been incredibly kind to lend us time and effort in organizing the feedback for today's event. We so appreciate it, Dr. Radhika Madhavan, Madam, who will propose the vote of thanks, has been heading the Department of French, Anna Adarsh College, for many decades. I hope you will enjoy this program as much as I did organizing it for you. Take care. God bless you. I now request our beloved Madam Principal to propose welcome address for our dynamic guest speaker, Dr. Dobson Dominic, MD, Sports Medicine, Saveetha Medical College. Thank you, ma'am.
Thank you, Dr. Sukanya. The key to a healthy life is having a healthy mind, said Richard Davidson. Distinguished chief guest, participants, staff, and students, a very warm welcome to this national webinar on mental health and physical fitness post-COVID-19. Coronavirus has affected all aspects of our lives, and the constant news about the pandemic can feel never ending. Not only is it impacting our physical health, but it is taking a toll on everyone's mental health too. Staying at home, social distancing, and self isolating are crucial in stopping the spread of COVID 19, but they can affect us psychologically. News of deaths, social alienation, fear, and resultant psychological trauma are indicative of mental health problems such as post traumatic stress disorder, depression, and suicide, says Roy Abraham, that is Secretary General of the World Psychiatric Association. In this scenario, the Department of Physical Education, Anna Adarsh College for Women, thought it fit to organize such a webinar to explore the ways and means of confronting and resolving the challenges posed. My heartfelt appreciation to the Physical Education Department and in specific to Dr. Sukanya for organizing this webinar. On behalf of the management, Punjab Association, I am very happy to welcome our chief guest, Dr. Dobson Dominic, MBBS MD in Sports Medicine. Dr. Dobson is a gold medalist in MD. He was a former associate professor at the Chettinad Academy of Research and Education, consultant sports medicine at Chettinad Super Speciality Hospital, between 2015 and 19, the founding vice president at ISSEM, Indian Society of Sports and Exercise Medicine, sports medicine consultant for the New Zealand cricket team in India 2016-17, sports medicine consultant for the Tamil Nadu badminton team, and so on and so forth. He at present is an associate professor at IISM Chennai and sports medicine consultant at Apollo Specialty Clinics and Spark Institute. With his vast experience in the field of sports medicine, he has addressed more than 150 conferences, CMEs, and corporate programs. Thank you, Dr. Dobson, for being here today to address the participants on the importance of mental health and physical fitness, especially during the pandemic. Once again, I welcome you all to the national webinar. Thank you so much. Thank you.
Dr. Saveetha, can we start the program? Hello, Dr. Saveetha, can we start with the presentation? Am I audible? Hello? Hello, am I audible? Yeah. Yeah, good morning to all. Hope I'm audible. All right, yeah. At the outset, I'd like to thank Punjab Association and Adarsh College for Women. This is not my first association with them. In fact, I was with the institute last year also. So thank you once again for having me during this testing times. I'd like to thank the college principal, Dr. Shanti, and also the main person responsible for conducting this webinar, Dr. Saveetha, Head of Department Physical Education, for creating this initiative to start with the webinar. So we'll go with the presentation. Thank you once again for the warm invite. We'll start with it now. Once I get out of this room. Again, good morning and welcome. I'm Dr. Dobson, Dominic from Saveetha Institute of Medical and Technical Sciences. So today I'm going to discuss with you all on the impact of physical and mental health fitness now and during post-COVID-19 situation. So let's just go into the webinar now. As Principal Madam said, we are in the middle of a pandemic. So I'm putting two pandemics. So middle of two pandemics. Why it is two pandemics. One pandemic we are all aware, COVID-19. The other pandemic, which you all should be aware, is the physical inactivity pandemic. So this physical inactivity pandemic is something which is exacerbated post-COVID-19. So COVID-19, you all know that we are all stuck up in our home. We are not able to move around. All the gyms, all the fitness centers, everything has pretty much ceased to close to nothing is functioning. So right now, the impact of lack of physical activity on physical and mental health is tremendous. So that is why this term physical inactivity pandemic. Now, this is not something which is new. Okay, physical inactivity was red flagged right a decade before itself by Lancet. So Lancet is one of the most respected journals. It said in 2012 that in view of the prevalence, global reach, and health effect of physical inactivity, the issue should be appropriately described as pandemic. So, in addition to COVID-19, now we have the physical inactivity pandemic. So, this is pretty dangerous. So, the implications of it will be long term. So, if you see the picture, you'll be able to. We've all evolved from Homo sapiens, from apes to monkeys, and then our forefathers were all hunters and gatherers, and then the industrial revolution came in. Now we are in the middle of a technological revolution. So at this point of our evolution, so our physical activity level has drastically come down, even before COVID-19. But after COVID-19, now the schools are functioning in computer, college classes are happening through computer. Pretty much our activity has been restricted to computer and screens. So as a result, you need to be aware that for you to be termed physically active, according to Tudor, so this is called graduated step index, at least you should be able to have at least 10,000 steps. So all the smart gadgets now comes with this step counter and cadence. So at least 10,000 steps you are supposed to have. So this COVID-19 has made it very difficult for us to achieve that. So less than 5,000 we term it as sedentary, 5,000 to 7,500 steps, low active, and 7,500 to 10,000 somewhat active. So for a healthy adult, you're supposed to have at least 10,000 steps for you to be termed as active and non-sedentary. Now, look, the sedentariness has got huge implications. So we are all aware that sedentariness will cause obesity. So obesity is a risk factor for most of the chronic disorders like stroke, hypertension, heart attack, atherosclerosis. It's a risk factor for diabetes. It's a risk factor for joint disorders. Pretty much, it affects pretty much all the human body systems. So physical inactivity, which is aggravated by this COVID-19, results in accumulation of visceral fat. You can see the accumulation of visceral fat, and as a result, you can see it pretty much affects all the systems. In brain, it can cause Alzheimer's, early degeneration of the brain cells. In heart, it can cause plaque formation and atherosclerosis. In the GI, it can cause insulin resistance, and as a result of that, type 2 diabetes can be fastened. Similarly, an increase in weight can also result in osteoarthritis and difficulty in joints. Okay, so sedentariness and obesity has been implicated as a risk factor in most of the conditions. Now there is a youthful start to obesity. So what do you mean by a youthful start? Now, as I said, all the academics, even the fitness program, everything is stuck up with in the computers and smartphones. Okay, so the children also, as a result, are glued to the screens. And due to that, the implication of that is not only obesity, it has got a lot of other issues also. So what can we do? So even for children, you need to impart something called functional. Okay, so it need not. So so if you can see this video for both the youngsters and adults, the implications of sedentariness is huge, and as a result, you're supposed to do some functional training at least in the home. Okay, so you don't need to have fancy equipments or big gym. You can very well train in home itself. Okay, so the impact of physical activity and exercise definitely is important. Other impact of physical inactivity and obesity is felt in the spine. Okay, so we as doctors we come across a lot of incidents of early spine issues like low back pain, cervical neck pain. All this you need to remember spine as two cylinders. Okay, the cylinder is made up of an outer core and an inner core. So the outer core is made up of big muscles, and the inner core is made up of the stabilizing muscles. So the base of the cylinder is your pelvic diaphragm, and the upper lid is your diaphragm. Now, the stability of the spine is made formed by all the ligaments. So the blue is the ligaments, and then the red one you see is the muscles. So you can't do anything with the internal organs, but you can definitely train your abdominal muscles. Okay, so the important core muscles. So that is where I would like to introduce the second concept. You don't need to again go to big gyms or fitness centers to do this. So you can do simple core training. Okay, simple core training by activating your abdominal muscles. Okay, so exercise like bridges, exercises like planks will definitely help in activating your core and keeping your spine strong. Okay, so we looked into the functional training first. Now we looked into the core training. So these two things which you can definitely do in your home itself. Now, what is the third one? I'd like to. So these are all aspects for health. Okay, so the third one, the most important one, is the impact of a doing good breathing exercise. Look again, COVID-19 situation. The impact of a good breathing exercise is very important. We should steady the mind and the body before doing pranayama or deep breathing exercises. So, breathing, if you see, is a link between body and mind. So, this gentleman is credited with to be the founder, or he is the forefather for, as far as yoga is concerned. Krishnamacharya is the gold standard. Okay, so he says in Patanjali to cure illness of the body, you can do asanas. But to cure the ailments of your mind, you need to do pranayama or deep breathing exercise. So even if you're not able to do pranayama or go to a yoga center, at least do deep breathing exercises regularly. Okay, do deep inhalation, hold for at least 5 to 6 seconds. So the principle is the hold should be more than inhalation, and the exhalation should be through your mouth, and it should be more than the inhalation and the hold. Okay, so this activates the important component called the parasympathetic system, and thereby the vagus nerve is activated and it will relax, and this is definitely beneficial during COVID-19. Okay, so the third one, the function. First one we saw the functional training. Second one we saw the core training. Third one, I would say the importance of deep breathing exercises or pranayama. Now, exercise alone might not be adequate, so you also need to concentrate on your health diet aspects during this pandemic. Okay, so if you dig deep into the net, there will be so much of diet programs. So which one is the ideal one? Depends upon your body type. Okay, so there's so many fancy diets right from 1972 when Dr. Atkins propagated this Atkins diet, and then came the paleo diet. Now there's a huge popularity for intermittent fasting, low carbohydrate, high fat diet. But I would recommend everything to be kept in moderation. So a balanced diet would be the ideal one, especially during pandemic. Now, just like exercise and diet, please give importance to sleep also. Okay, so a lot of people ignore sleep, especially now with the impact of social media and smart screen. Sleep has taken a big hit. Okay, so the impact of sleep is not only felt for normal people, but even for athletes. We say for athletes there is a decrease in performance. Sleep deprivation also causes obesity. Okay, so sleep is very important both for the quantity of the sleep is important, also the quality of the sleep. So all this will encompass sports medicine. We deal with two aspects. One is the human performance, and the other is athlete injury and illness management. The human performance deals with exercise physiology, biomechanics, psychology, nutrition, while the other aspect, medical management and injury management, doping, and sports emergencies. So, what I want to emphasize on sports medicine is now, again, there is a slow opening up of all gym activities, slow opening up of fitness activities. So, it is very important for you to seek a proper sports medicine advice before starting on a training program. Just a brief note on the impact of COVID-19 on exercise and athletes. Just don't think that even if you're a good sportsman, you can suffer from COVID-19. It doesn't, being a good sportsman doesn't bar you from getting COVID-19. You have the recent history of Novak Djokovic, world's number one tennis player. He even he didn't listen to the authorities, and they conducted a tennis tournament, and ultimately all the players tested positive. Okay, so being a sports player doesn't prevent you from getting COVID-19. So please follow all the instructions the authorities say if you are there in an epidemic prone area. Before, so suppose one of your player gets COVID-19, there is nothing to be panicked. Okay, so again, emphasize the importance of good hydration and balanced diet. Deep breathing exercise pranayama is very mandatory. And when you're returning to sport, okay, so after COVID-19 episode has gone over, how to restart your exercise or sporting activity. At least 7 days, there should not be any symptoms, and then you start with moderate, not severe exercise. Please don't start straight away with severe exercise. And it is advisable to take supplements like vitamin D3, vitamin C, and zinc. Okay, so a gradual return to play should be emphasized. As I said, sports medicine assessment of the athlete before starting is very important because COVID-19 does not only affects the lungs but can also affect pretty much all the systems, and the most important being the impact on cardiovascular health. So it's very important that sports medicine assessment is done to prevent sudden cardiac death and also to differentiate between athlete's heart and pathological heart. Now let's a few slides on the importance of injury prevention and management. Okay, so for you again, all the athletes will be detrained currently. There is no regular sporting activity yet happening. So please understand, you have to slowly start with all the training program so that you prevent injuries from happening. So if there is any injuries, keep in mind sports medicine advice need to be stopped. And one recent advance I would like to stress is the impact of growth factors in treating sports injuries. You all will be aware about physiotherapy. So this is a newer advanced growth factors where we inject platelet-rich plasma or platelet cells into the affected region and thereby allowing it for faster healing. Now, since this talk is also going to deal with a lot of coaches and trainers, so I felt that trainers, so for you, a brief introduction to the science of performance also will be useful. Okay, so how can you create consistent excellence in sports? Is it the impact of genetics? Is it the impact of environment, coaching, or training, or individual player motivation? Let's see each and every one. The first one, as I said, is the impact of genes. Definitely, genes has a very important role, especially in sports like athletics, especially sprinters. If you see especially the races like blacks, Jamaicans especially, have something called ACE gene, fast gene or ACE gene. ACE gene is TN3 gene, which allows them to run faster. Similarly, there are genes like myostatin, IGF-1, which will help in lifting. Okay, so genetics definitely has a role in dictating performance. Now, body composition or the body type also matters in certain sports like basketball. It is very basketball or volleyball. It's very uh, advantageous for you to be thin and tall. Okay, so they are called ectomorph. And the other one, mesomorph, is when it's more of athletic type or the body is very muscular. And the third one is endomorph, where you put on too much of fat. So all this can be done through an analysis called body composition analysis. So it checks. So, yeah, so uh, it measures the fat percentage and it also measures the body's muscle content. Okay, so body composition analysis definitely plays an important part. The other component of environment and science. So if you are going to train marathoners, definitely it's advantageous for you to train in a higher altitude and live low. So these are all new sciences, sports science components, which will help you in performing better. Sports psychology is very important, just like how mental health is important for a normal person. Sports psychology is very important for performance. Sports physiology again is very important. So sports nutrition, again the importance is huge. So in Saveetha we have a course called MSc in Exercise Physiology and Sports Nutrition, which will handle both physiology component and sports nutrition component. Biomechanics also is a part of sports science which will dictate the performance, where we assess the movement patterns. And again, this is important for injury prevention and performance parameters. So this is So this was the analysis about the jump smash in badminton. So basically in biomechanics, we assess the individual body parts components so that how much, if there is any muscular imbalances or if there is any weakness, we can identify and help in correcting the movement patterns. So biomechanics plays an important part. Now the newer advances, like you should also be aware about the technology. Sports technology also plays a very important part in performance. Shoes, rackets, surfaces, all are continually evolving. So an awareness about sports technology will definitely help. Now, again, I would like to come back to the basics part of it. So what is fitness, athleticism, and LTAD? So LTAD is called long-term athlete development. Okay, so if you as sports coaches are involved in training young players, then you need to have a broad understanding about LTAD or long-term athlete development. For that, you need to know the growth pattern and maturity. Okay, so when I talk about growth, you need to know when the girls will attain the maturity, when boys will attain the maturity, what age they will have the peak strength velocity, peak height velocity. So what is the difference between biological age and chronological age? Chronological age is basically your 10 years age of the child. Then chronological age is also the same, 10 years. Biological age depends on a lot of hormones like parathyroid hormone, growth hormone. All these hormones play an important part in biological age. So biological age is important in giving training programs. So maturation again is very important because young girls mature much faster compared to the young boys. So bone maturity, neuromuscular maturity, mental maturity, everything plays an important part. So maturity assessment is done through skeletal age, X-rays we do, X-rays, secondary sexual characteristic, and peak height velocity. Why I put these lines is, being sports coaches, you should be able to know at what age certain exercise programs like training for stamina, training for strength, training for speed, training for skill, and training for flexibility can be given. So this appropriate training at the appropriate time will result in accelerated adaptation. If it gives flexibility training very early to a child, then definitely that his flexibility will be optimal. So that is what we do when it comes to long-term athlete development. So long-term athlete development has a big history, right from early Olympians. In Greeks, they used to train the soldiers for Olympics. So they were called agogi. So in Cold War, again in 1950s, US, Russia, they gave a lot of importance to sports science, and that is where this concept about long-term athlete development started. Now the current model is by this Canadian scientist, Belly. Okay. Now there are some stages to the long-term athlete development. Active start, and then we teach some fundamentals, and around 9 years we start training them. Then from 12 to 15 years we allow them to go for scientific training. Then around 15 to 16 years emphasize on competition, and then around 19 years you try to bring them high performance, and then they need to be active for life. So it challenges in long-term athlete development is early sports specialization. So there is a lot of sport in academies and everything. So and as a result, there is a lot of over competition and over training happens. And as a result, the athletes, young athletes, may be psychologically overloaded, and burnout and dropouts can happen. Young girls, there is risk of depression. Nutritional issues might arise like female athlete triad, menstrual disturbances, low bone mass, energy deficiency can all arise if you don't give concentration to the athlete's development. So an integrated approach will concentrate both on performance coaching and performance health management. So now coming back to so that was some slides on performance. Since a lot of the participants I felt were also coaches and physical trainers, it will help you in having designing programs for your young athletes. So always remember, LTAD stands for long-term athlete development, and you should impart sports science in it. Now coming back to physical and mental fitness, which is the core topic today. When you are giving a training program, now in again COVID-19 has impacted, so you need to adapt and give training program accordingly. So the formula for you will be SET. Principle is something called SET. S stands for specificity, A for adaptation or progressive overload, I for individuality, D for detrain. Why this principle is important is the sense because everybody currently is not training much. Okay, right now. So when you're giving an exercise program, it is very important for you to understand these principles and give exercise programs which are specific for the athlete's need and progressively overload and targetedly give for that particular individual. Okay. So the training principle is very important. Uh, Please remember this mnemonic set. Now, coming back to the basics, what type of training can be given? Okay, there's broadly you need to understand there are two types of training: aerobic and anaerobic training. Aerobic training, running, cycling, swimming, all forms under aerobic training. Or anaerobic training is pretty much strength training and lifting weights. Okay, so both has got huge benefits. Aerobic training has tremendous impact on heart, serious endurance. It brings down the resting heart rate, brings down the low blood pressure, increases endurance, increases lung muscle strength, and decreases body fat. Similarly, a lot of people have some myths towards resistance training or weightlifting, especially myths that girls should not lift weights, ladies should not lift weights. It's a wrong myth. Resistance training has got huge benefits. Okay, so everybody should do some form of resistance training or anaerobic training, which is beneficial for muscle strength, muscle power. It also decreases blood pressure, it improves the endurance, increases the muscle size, and brings down the body fat. So broadly, aerobic and anaerobic training both are important. Now, strength training is better or aerobic training is better for older athletes? Older, I would say both are beneficial. Aerobic and resistance training both are beneficial, but the current consensus is resistance training as you grow old has got much more benefit compared to only aerobic training. People only, we go to a general physician, they might advise you to go for a walk, or they might advise you to go for a jogging. Okay, so that is an old concept. Yeah, as you grow old, you need to concentrate on your muscular strength also. Okay, so the modern view definitely resistance training has a positive effect not only on cardiac conditions but also even to prevent cancer, to prevent blood pressure, hypertension. Resistance training definitely has a huge impact. Okay, now just a brief few slides on the current advances or the recent trends in fitness. Okay, so there is a lot of newer technologies which has come for fitness trends. So you even for you, a lot of sports coaches and trainers, you need to be aware about the current trends. COVID has made all the older trends completely restrained. You need to be good with technology. You need to give a program online through Zoom, through WhatsApp. So you need to be adaptable. Okay. So you need to know the recent trends. The recent trends focuses on wearable technology. What is wearable technology? Or you can even in the watches, in the you get to measure your physical activity level, to measure your heart rate level. There is even exercise programs are given through the newer technology watches. So wearable technologies, new group training, high intensity interval training, training with free weights, concept about body weight training, and concept about health and wellness coaching. Okay, so these are all newer trends. Also, new trends is the trend on high intensity interval training. Okay, so now a lot of the newer generation people have lack of time. So all this concept about high intensity interval training is basically focusing on a very short duration. You can achieve all your physical fitness through a very short duration. 20 minutes workout is enough. You don't need to actually go to gym. You can very well have some functional gadgets and train at your home itself and be physically fit. There's something called, again, this is has to be blood flow restriction training or BFR training. This has to be done under the supervision of a sports medicine expert because BFR training is predominantly done for athletes. Okay, so if you are interested, you can just go dig deep and do some research on blood flow restriction training. So we looked into all the aspects of physical fitness training. So I'd like to concisely put for physical fitness training, you need to be adaptable now, you need to be good in technology, and you need to know the recent advances. Now coming back to mental health. Okay, so mental health, the impact of COVID-19 is huge. Okay, so there are sleep disorders, as I already said. There's a lot of incidents of depression. Even in elite athletes, there is tendency for depression happening because athletes not sure when the sporting activity is going to start. Nobody is sure. So as a result, depression can happen. There is a lot of news about suicides happening even in famous personalities, famous film stars because of the impact of COVID-19. Anxiety-related disorders has increased, bipolar disorders have increased, eating disorders. All this has got impact on your mental health. So you need to teach your athletes to be psychologically resilient. You need to be good in stress management, emotional resilience, and mental resilience. Now, I'll just briefly share some of few slides on this taken from the government website. So they emphasize some 9 important steps for your mental health. So the first one, as I said, is a good sleep. Importance of good sleep is very important. As I said, both quantity and quality. Exercise regularly. Concentrate both on your aerobic and anaerobic. Avoid alcohol and drugs. Practice meditation. Deep breathing exercise, pranayama is very important. Connect socially if possible. Okay, so reduce screen time. Again, this is easier said than done because classes are now in screen. Fitness session is through screens. It's very difficult, but you need to find ways to reduce screen time and media exposure. Definitely try to learn new skills, eat healthy, and connect with nature. So get good sleep. The quantity for adults at least 7 to 8 hours, and for children at least 10 hours. This is the recommended sleep quantity. Okay. Otherwise, the impact on mental health is huge. Sleep deprived becomes a vicious cycle. You become exhausted, unable to do your daily activities, and you get stressed out a lot. So, emphasize on a good sleep, which is very important. And also for your young athletes and please recommend more than 8, if not 10 hours, at least more than 8 hours, around 8.5 to 9.5 hours of good sleep should be there. Regular exercise, at least WHO recommends 150 minutes of moderate intensity. So that is very important. At least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activities. Aerobic can be anything. You can walking, jogging, doing skipping, climbing stairs, anything will be aerobic activity. And 60 minutes of moderate to vigorous intensity physical activity daily. So this is important. So CBSE has now made sure daily 1 hour physical education for all the classes. So that is very important. So regular exercise for children, again, because they are all the classes, everything is through smartphone, and they are always sitting right now. They're not able to get the lack of or recruit physical activity. So please keep them novel programs so that children at least get 60 minutes of moderate to vigorous intensity activities. Even for older, at least older adults, 3 days of physical activity a week to enhance balance and prevent falls for older athletes, older adults. Avoid alcohol and drugs. This is self-explanatory. Practice meditation, yoga, pranayama, deep breathing exercises definitely plays a very important role. Socially connected, again, be open to sharing and listening. Social connection is important. It helps in preventing depression. Emotional well-being is also equally important as like a physical well-being. Try to learn new skills. If you're still stuck up in home, try to learn even for males, they can try cooking. If they don't already know some cooking, they can also try. You can also do some drawing, singing, dancing. All this will trying new skills will definitely help you in keeping your mental health intact. Reduce screen time. Again, as I said, this is easier said than done. But overconsumption of media result in anxiety and depression. And as a result, social isolation becomes very common. So this is very, very important, reducing the screen time and exposure to media. Eat healthy, balanced diet, as I said, for reduce your junk intake, reduce your dependence on white sugar, uh, pastries, reduce your trans fat content, and focus more on your healthy fruits and vegetables, and also healthy fat. Okay, healthy fat is also very important. So balanced diet is very important, and if possible, it's very difficult in the cities. At least, if possible, try to connect with the nature. Okay, so caring and nurturing and trying to be close with nature all plays a very important part in your mental health. Do not neglect your mental health. Okay, so mental health affects both your cognitive, emotional, social, physical well-being. This is very, very important. Okay, so mental health. If you have any issues, please seek the professional advice at the earliest. Do not ignore these symptoms: appetite change, agitated behavior, low interest level, any fear, helplessness, anxiety, feeling worthless, social withdrawal, difficulty concentrating, difficulty in sleeping. Please try to seek a proper uh, expert advice so that you can look. A lot of this physical ailments can be handled easily, but mental ailments will take time for it to be externally addressed. Okay, so if there is any doubt in any of your youngsters or young athletes, please seek proper psychological advice very early stage. So to conclude, both physical and mental health is very important. So keep your physical activity level high. What happens to your body when you stop exercising? 3 to 6 weeks, there is memory issues. 3 days you don't do exercise, your blood sugar is elevated, your endurance level comes down, BP increases, your muscle strength comes down, and your muscle power diminishes. So COVID-19 has made everybody confined to a home, and as a result, the implication of physical inactivity in all the systems, not only heart, lungs, on your muscle, everything, sedentary behavior should be avoided, and try to become active one way or other. Okay, you need to find ways. That's why I initially put some slides like functional training, core training. Somehow find ways to make yourself active and get at least 150 minutes of moderate exercise. So finally, to conclude, I would like to introduce this term EIM. Okay, EIM states exercise is medicine. Okay, so regular physical activity will definitely help you prevent obesity, prevent arterial hypertension, maintain your cardiorespiratory fitness, and prevent MI, prevent diabetes, and prevent cholesterol issues. So, as Christian Bernard, the very world famous heart surgeon, said, I have saved the lives of 150 people by heart transplant. But if I had focused on preventive medicine, that is exercise medicine, I might have saved 150 million. So you can sense the significance of the terminology EIM. Okay, so regular, moderate to vigorous activity reduces the risk of heart disease by 30 to 40 percent, and also reduces the risk of stroke or cerebrovascular accidents by more than 25%. So I would like to conclude this talk by saying this famous saying: if exercise could be packed in a pill, it would be the single most widely prescribed and beneficial medicine, according to Robert Butler. Again, thank you for the opportunity, and if there is any doubts, I'd like to address it. Thank you.
Thank you, Dr. Dobson, sir. Can you hear me? Thank you,
Yes,
Dr.
thank you.
Dobson.
Thank you, Doctor. Thank you, Dr. Sukanya, ma'am.
There are a few questions. Can I ask you, sir, during this
Yeah,
session?
yeah, please,
Wonderful.
please, please, please.
Thank you for the wonderful session and gave us today. And what is the differentiate between the well-being and ill-being?
Okay, so as per WHO, well-being will be defined not only by physical and mental health, you also have to be socially connected. Okay, so well-being emphasize on wellness, not only your physical wellness, you have to be mentally stable, socially connected. As I put the slides, you need to be socially connected, you need to be socially connected to a little bit of nature also. Okay, and you need to have some philosophical outlook like caring also. Ill-being is either of any of ailments in your physical or mental health definitely will result in ill-being. Okay, so both your physical and mental health is important for you to be termed as well-being.
And one more question, sir.
Yeah,
You conclude your session with EIM. That is,
exercise is medicine.
where
E-
can
uh,
where can older adults find help for mental health concerns? Other
so
than EIM.
yeah, so for older adults, you need to look at it in a holistic manner. Uh, I'll just stop sharing so that I see your not able to, yeah. Uh, yeah, so for older adults, I would like to emphasize on again emphasize on 150 minutes of physical activity. Okay, so and for mental health, you need to focus more on things like deep breathing exercise and pranayama, and also emotionally connected and bonded with the social environment. Okay, so physical and mental health is interconnected. So if you are physically active itself, that itself gives a positive endorphins and positive hormones are there, which will result in a positive mental health. So for mental health, exercise is important, good sleep is important, and being socially connected is also important.
Sir, is intermittent fasting advisable? Will it cause acidity? For older people, what will be the daily routine your advice?
Yeah. Again, so all those newer diet programs like intermittent fasting or low carbohydrate, high fat diet has to be done under the supervision of experts. Okay. So intermittent fasting definitely has got huge benefits in bringing down your obesity, bringing down your weight level, bringing your blood sugar under control. It has also been recommended for cardiac patients also. But as you rightly said, there is issues like GERD, GI issues like acidity, gastroesophageal reflux disease can all be aggravated if the intermittent fasting is given to the wrong people. Okay, so that is why it is important you get a physician advice first and make sure that are you the right candidate for that particular diet program. Okay, just don't follow a blind program which you see in the internet and then start following intermittent fasting. You might have issues, other issues. You might lose weight, but you will land up in other medical problems. So please get a proper physician advice or a nutrition advice before following on. But intermittent fasting definitely has huge benefits. Yeah.
Sir, you in your session you asked us to involve us whichever make us happy, joy, and whatever dancing and painting, what you advise us to do
Yeah.
other than exercise.
Yeah.
How, but how can I reframe the situation and find more balanced perspective in this COVID situation?
It is tough. That's why you need to be adaptable and you need to find novel ways to keep moving. So, just like I say, put exercise as medicine. So, some you can also include this term MIM, movement is medicine. Just being movement, mobile enough. That can be dancing, that can be you doing some martial arts. So all this doesn't require actually big studios or it doesn't actually require you to go to some dedicated centers. So you can actually follow these programs. you can actually follow those programs in your home itself. So you need to be adaptable and you need to be able to follow this technology. So movement is also medicine. Okay, the main thing is you avoid physical inactivity and sedentariness.
Thank you so much for all the answers, and we are delighted to hear you, Dobson sir.
Thank you.
Thank you so much for the wonderful session. Let me call upon Mrs. Padmavati for her feedback from Dubai. Hello. போடுமா இருக்காங்க மியூட் எடுங்க அவங்க மியூட் எடுங்க Mrs. Padma. Please join Mrs. Padma. ஹலோ ஏன் அவங்க தான்
Please come. To unmute her.
You're audible, Padma. Please talk.
We can't hear her.
I thank the management, the principal, and the physical education department of Punjab Associations, Anna Adarsh College for Women, Chennai, Tamil Nadu, for organizing this national webinar on the topic of current pandemic situation. Thank you, Dr. Dobson, Dominic, for sharing many useful tips to maintain good physical and mental health during this pandemic situation. Related to core and spine, how to maintain our sleeping hours, cardiovascular health, body composition analysis, environment and science, sports psychology. As a coach, I'm very much impressed about your topics, new methods to heal sports injuries. And exercise is medicine. I'm very much impressed with that slogan. So far, I was using fit is hit. Now I changed mine as the exercise is medicine. like the same, you have explained a lot about LTAD, that is new for me. Um, hit workout, so many things. Um, I'm a coach as well as physical education teacher in school actually. We were taking online classes for now it's summer break for us. To use this summer break, I have assigned so many assignments to my students to click their performance videos and post it in Flipgrid. Every week, I'm checking that to maintain and their physical fitness, as well as I keep in touch with my students through WhatsApp, so many social media. Uh, your information were very much useful to me as a coach, as well as I shared the same details with my students as well. Sir. Thank you so much for giving us useful tips. Overall, it's a very informative webinar. Thank you all for sharing, giving me this opportunity to share my views. Thank you.
Thanks, Mrs. Padma from Dubai, and my Ragapa classmate and my close friend. Till date, we maintain our friendship. Thank you so much, Mrs. Padmavati. And now I call upon Ms. Yamuna, Sports Secretary of Anadash College 2001, 2020-21, to propose the feedback. Yamuna?
Yes, ma'am.
You please propose.
Yes, ma'am. Being a sports secretary of Anna Adarsh College, I appreciate Dr. Suganya Madam, Head of the Department of Physical Education of Anna Adarsh College for Women, for organizing such a good and a valuable webinar with an appropriate topic for us during this lockdown period. The session discussed by our esteemed speakers, Dr. Dobson Dominic, MD Sports Medicine and Sports Science, Saveetha Medical College, Chennai, had the had the natural ability to hand out presentation material in a very organized way. Your presentations were visually stunning and effectively captivated the viewers well done. This period of lockdown is the great time for you to touch on these topics and thrive at the challenge. Keeping presentations focused on key agenda in a live webinar is really tough, but you have effectively outlined all the COVID-19 matters. You created downloadable visual presentations and very useful too. Your content was relevant and your format was visually appealing and easy to follow and understand. It effectively grabbed all our attention during this webinar. Thank you.
Thanks, Yamuna. Thank you so much. I now call upon Dr. Radhika Madhavan ma'am, who will propose the vote of thanks. And she has been heading the Department of French Anna Adarsh College for many decades. Welcome, ma'am.
Good morning, everybody. Human beings are masters of resilience. They turn chaos into brighter futures. They do not permit storms to stay stormy. They morph downturns into good days, eventually. On behalf of the Department of Physical Education, Anna Adarsh College, it is indeed an honor to propose the vote of thanks for today's national webinar on mental health and physical fitness post-COVID-19. To our guest speaker, Dr. Dobson Dominic, MD, Head Department of Sports Medicine and Sports Science, Saveetha Medical College, Chennai, we offer our heartfelt thanks. Sir, your brilliant, well-researched presentation is like a shining light which will guide us through this tunnel of tumultuous despair. Thank you ever so much. To the members of the Management Punjab Association, our absolute gratitude for not limiting what we have, can be, or do. To Dr. R. Shanti, Principal in Charge, Anna Adarsh College, thank you for your support. To Dr. S. Sukanya, Organizing Secretary of today's event and Director of Physical Education, Anna Adarsh College, our appreciation for not fearing to take difficult roads which have always led us to beautiful destinations. To Mrs. A. Padmavati, BWF coach and national umpire, Sharjah, UAE, for your invaluable contribution and time, we cannot thank you enough. To the faculty, students of Anna Adarsh College, and all the participants, for your silent acts of support and patient hearing, our sincere appreciation. I would like to quote from the recent Nike ad: no matter how bad it gets, we will always come back stronger because nothing can stop what we can do together. After all, you just can't stop sport. Thank you. God bless.
Thank you so much, all the viewers and participants, for the wonderful session. Thanks for the speaker, Dr. Dobson, sir, and we are closing the session. Thank you so much. Thank you, ma'am. Thank you. சரவணன் ஸ்டாப் பண்ணிடுங்க, முடிஞ்சு போச்சு. ரொம்ப தேங்க்ஸ்.